And very, very excited to have our new adult psychiatrist with Barton Psychiatry, Dr. Aubrey DeMay. And then also you'll see on the screen, we've got Sarah Hart. She's a registered nurse and lactation educator. And she'll be speaking a little bit later on in this webinar. Just wanted to let you all know, if you have questions, feel free to ask them in the Q&A box at the bottom of your screen, or you can ask them in your chat box, whatever is easiest, and I'll help facilitate the questions at the end of this presentation. But I'm going to go ahead and hand it over to Dr. DeMay. Thanks so much for being here.
All right, and everyone can hear me? Natasha, you can hear me?
I can hear you.
Great. Well, it's nice to meet everyone, kind of. I'd like to meet more of you, and I look forward to meeting more of you in the future in person. But I have a really special interest in maternal mental health. So this topic is right up my alley. I love to take care of maybe future moms, soon to be moms, and moms. And it's also perfect because it's almost Mother's Day. So this talk is about peripartum mental health. Peripartum just means mental health before you give birth and after you give birth, both are included. And a little bit about me, just because I thought people might like to know a little bit of context of who this person is. Thanks a lot for welcoming me into South Lake Tahoe. I was raised in the Bay Area. I grew up coming to Tahoe to ski. I've actually never been here in the summer, and I've heard great things, so I'm really looking forward to it. I trained at Hopkins, UChicago, and then most recently I finished my psychiatric residency at the University of Washington in Seattle. And I take care of all adult psychiatric concerns of any kind. And that starts from about 16. I also work with primary care providers to improve their comfort with psychiatric care and improve patient access, because primary care providers, I actually did a year of an internship in family medicine, and they see more patients with psychiatric concerns, anxiety, and depression than I ever will, just because they see so many more patients. So they definitely are a great resource for your mental health concerns as well. And I'm very happy to be able to call Tahoe my new home. And like I said, I love this topic. So here are some things that people might say to you when you have a new baby. Congrats, you're so lucky. Look at how cute they are. This is the happiest time of your life. Oh, I loved being pregnant. Aren't you just over the moon? You've got nothing to complain about. Look at this healthy baby. There's no better feeling on earth than being a mom. It goes by so fast, soak up every minute, on and on and on. And all of that can be true. Same baby and same you. And you might be thinking these things that various patients have said to me in many forms over and over the years. I'm so bored and tired, bored and tired. I've never been so tired in my life. There's a lot of tired. Where do I fit into all of this in this new world as a mom? All I am is a mom now. This should come easier to me. I love my baby, but I love my old life and sleep too. I wish someone would ask me how I was really doing, not just how's the baby. There's no more complicated role on earth than being a mom, and that complexity can feel really heavy. How can I keep doing this? And how in the world is it only 9 a.m. when you've been up since 4? And both of those things are true. And in psychiatry, we call that dual side of reality ambivalence. You can feel two ways about the same thing, and they don't negate each other. So you can both be over the moon thrilled about your new baby and over the moon overwhelmed or stressed about the reality of having a new baby. And that's normal. We're not talking about mental illness yet. I'll make that clear when we get there. That is normal. There's a lot talked about how in the past, people used to talk about a mother gave birth, or she's a mother now, rather than a child was born. The emphasis being, when you say that she gave birth, that she's gone through this very major transition, and the focus is on the mom rather than the baby. So I think it's really interesting if you think about the moment of birth as not only a child is born, but a mother is born. And what can you expect if you don't experience postpartum depression and anxiety? To be the emotional experience, the mental experience of becoming a mom, of all of a sudden, now you have this new identity. So there's actually a word for that in psychology, psychiatry, called matrescence. And you can basically think about that as the time that you work through your identity as a mother, that you go from being not a mother to a mother. It's like puberty in that it's a transitional time, and it's possibly the single largest identity shift of a woman's life if that woman becomes a mother. Here's a quote about matrescence. It's a holistic change in multiple domains of your life. You're going to feel it perhaps bodily, psychologically. You're going to feel it with your peer groups. You're going to feel it at your job. You're going to feel it in terms of the big philosophical questions like, what do I want out of life? Who am I? What's important to me? And I think labeling that transitional time, not just as postpartum, but as this emergence of yourself as a mother, is something we could benefit from focusing more on in the normal postpartum period. And so when I have patients come and they're concerned that they might have postpartum anxiety or depression, a lot of times they come in and they say, I think I have postpartum. And I think that sort of as a protective mechanism, society has gotten in the habit of calling postpartum depression and anxiety just postpartum. But I actually think that's really misleading, because everyone has postpartum in terms of everyone who's given birth. Every woman has a postpartum time, and labeling that as postpartum, some call it the fourth trimester. There's even some people talk about a fifth trimester now, which is when you go back to work, if you do. Everyone has a postpartum period, and there's a lot that happens in that period. And that is very distinct from having postpartum depression or anxiety. And again, postpartum just means you're post or after being pregnant, so after you've given birth. So we are talking about normal postpartum mental health right now, not postpartum anxiety or depression. So day 3 after you have your baby is called the teary day. I don't know, I'm sure there's many other names for it, but it is almost like clockwork, famous for being a day full of tears for women after they give birth. I'll read these quotes. Day 3 in particular is infamous for being emotionally difficult. The birth buzz is wearing off, estrogen and progesterone levels are dropping off, and prolactin and oxytocin levels rise and fall throughout the day while the baby suckles as they nurse. That, combined with sleep deprivation, makes for a lot of weepiness and feeling like nothing is going right. So that should be part of, if you're pregnant, an expectation that you not only have, so that you can be kind to yourself when it happens, but so that you can also share that expectation with the people that will be hopefully supporting you in various ways, so that they know that that's part of the normal postpartum period. And so part of the reason why it's so predictable that day 3 will be difficult, and they mentioned this in that quote from the midwife, is because of these hormonal shifts that you can see on this graph here. And the vertical line is giving birth. And so you can see that you have there's no units here, but you can imagine this is a very high level of progesterone and estradiol, which is just a form of estrogen. And as soon as you give birth, they plummet. And that is probably one of, if not the most drastic in terms of how much of a hormonal shift happens in how short of a time, it's got to be in the running. That along with menopause, giving birth is one of the most drastic hormonal shifts you will ever experience in your life. And so my advice to patients is always set your expectations accordingly. So if you, when you are in the days before your period, have emotional shifts, then if you have some irritability or you're a little bit more tearful or overwhelmed, imagine that very much exaggerated. And the reason why I called this talk Peripartum Mental Health is because the experience of pregnancy is also one of extreme emotional change, extreme hormonal shifts, and therefore extreme emotional change. And so people can have changes in their mental health while they are still pregnant that do not meet criteria for a mental illness, but are significant in their day-to-day lives. Then, of course, we just discussed delivery as a time of extreme emotion, hormonal and therefore emotional shift. And then also people often forget about weaning, which I really like to remind people that weaning is a time of, again, an extreme hormonal shift. And therefore you can expect, and many people actually can present, which we'll talk about later, with postpartum depression and anxiety at the time of weaning, or in case anyone doesn't know, that would mean stopping breastfeeding. So a lot of people hear about this term, the baby blues. Again, just to put the disclaimer, we're still in quote unquote normal mental health postpartum. So the baby blues are just sort of what the teary day 3 kind of kick off. They start almost like clockwork on day 3. They're so common that pregnant women should expect them as a natural part of normal recovery postpartum. So you should expect that you will be emotionally turbulent and unlike yourself during this day 3 to typically maybe around week 3 area, but a good 2 weeks is pretty common. Over 80% of women endorse having these symptoms that I'll outline in a second that would constitute the baby blues. So you would be well served to just expect that it's going to happen, talk about them with your partners. This is where things like having friends deliver meals but not stay over and visit, having people that you can call when you just need to cry, having the expectation that your partner will take the baby when you have some sort of code word like, I need a walk, and you can just go, is really helpful. Its expectations are just huge. So people describe the baby blues as they feel overwhelmed, stressed, worn out, they're panicked even, and just highly emotional. There are as the name suggests, the baby blues, there are a lot of tears from baby and mom. They typically, in the baby blues, you will feel quite bonded to your baby, but the feelings are more centered on the overwhelm of the baby's demands, which are around the clock. And you get better pretty quickly. So definitely by week 4 postpartum, you should feel like you're kind of on the other side of something. And so that's why I like to tell people that a lot of people take month photos. And so baby's 1 month photos are a really great time to check in with yourself. And to really ask yourself, do I feel like I'm on the right track? Meaning, is it getting a little bit easier? Do I have my feet under me a little bit more? Do I feel like I can take a deep breath? Like I'm on the other side of that first big hurdle? Do I look back on the last month and think, oh, that was hard, but I did it and I'm feeling a little bit better? You're not a pro, but you're feeling just a little more grounded. And am I having time where being with my baby can feel enjoyable? Time where I feel like I'm present and calm. And if overall you can endorse this sense and trust your intuition about it, then you probably had the baby blues, as almost everyone does, and you've now moved on to the next part of your recovery and your matrescence, your transition into being a mom, or your transition into being a second-time mom or a third-time mom, because this applies every time you're pregnant. And most moms of multiple children will tell you that every pregnancy, every delivery, every breastfeeding experience, and every mental health journey through all of this is unique to every child. So a little bit more about what's normal in the postpartum period. Feeling exhausted and overwhelmed at some point, most days, is normal. The postpartum period is by definition, like in medical books, 12 months long, but I really see that it's 18 months before most women truly feel like they are on the other side of that whole matrescence, that whole coming into now I'm the mom of these 2 kids or these 3 kids or my first kid, back to their new normal. Because they've gone through matrescence, they are not the same person they were before they had this child. In many ways they will be, but not quite. Feeling like you are not enjoying the enjoyable parts, that you can never relax, that you can't eat, that you can't sleep, that you aren't bonding to your baby, or are having thoughts, even if they are thoughts you would never imagine yourself acting on, of hurting yourself or the baby, is not ever normal for the postpartum period. Those are signs of postpartum depression. So I'm going to repeat some of those and maybe elaborate. So not enjoying the enjoyable parts, those moments where there is no diaper to change, there is no breastfeeding to finagle with, the baby is cooing, and you feel yourself removed from the joy of that moment, not normal. That you can never relax. Maybe baby's asleep in the other room, you're sitting with your spouse or your partner watching something you would normally enjoy, and all you can think about is whether the baby is breathing or not. And it's really difficult to find any reassurance that they're safe, that you can't eat, that your appetite is just evaporated, you can't sleep. So even though baby might be sleeping next to you in a bassinet, you find yourself just awake, maybe awake and just down, or awake and anxious. You aren't bonding to your baby. I think I have a quote that comes up that says, like, if you feel like you are just kind of assigned to care for this child, rather than feeling this kind of at times immense joy and awe of your child. And that you're having thoughts, even if they are thoughts you would never imagine yourself acting on, of hurting yourself or the baby. Those are called intrusive thoughts. And there are some intrusive thoughts that are actually very normal postpartum, and actually women experience them past the postpartum period with their children, of thoughts that are sort of your brain imagining what could happen to your child so that you never let it happen. Intrusive thoughts, the most common one is you're standing on a balcony with your baby in your arms and you have this image of your baby falling. Those are actually normal if they are not obsessive and overwhelming, if they're just sort of these weird moments you're like, oh, why did I think that? But if you're having thoughts that are recurrent of hurting yourself, or sometimes thinking it wouldn't matter if I wasn't here, or the baby would be better if I wasn't here, or of hurting the baby, that is never normal. And so those would all be signs of postpartum depression. Postpartum depression is a mental illness. It is not a normal part of recovery and adjustment to giving birth. It needs treatment, and it can be serious in its consequences for mama, baby, and family if it isn't treated. So I always like to say that first quiet voice, or the first time the light bulb flickers on of maybe something isn't right, that moment is the moment to make a plan to head to your OB's office, to get a hold of your primary care doctor, if you have a psychiatrist, to talk to them, if you have a therapist, to get a hold of them, or to call a helpline, which I'll have at the end of my talk today. Most women tell me, and that includes women who unfortunately never sought treatment, that they actually had a sense very early on, intuitively, even if it was their first child, that something wasn't right in how they were navigating this transition. And so again, just reach out for help. All right, so now we're moving into postpartum depression and anxiety. So leaving behind the normal and coming into where mental illnesses will be diagnosed, and we would encourage you to seek treatment for them. So postpartum depression is actually the most common complication of childbirth. Statistics vary, but about 1 in 7 women in the United States in our current time will develop postpartum depression. And I just want to make this caveat. At some points, I'll just mention postpartum depression. Postpartum depression and anxiety, just like not postpartum, typical adult depression and anxiety, they are really kind of two sides of the same coin, so to speak. Oftentimes, people kind of will either gravitate towards depression just by nature or gravitate toward anxiety just by their nature. Our treatments are very similar. So for this talk, I will really talk about them interchangeably. A lot of their presenting symptoms are very similar. For example, like I mentioned earlier, you can't sleep when the baby is asleep, whether it be because you're so anxious about yourself or the baby, or because you are so low and depressed. So this includes anxiety. Why? What are the causes of this most common complication of childbirth? And as in everything in psychiatry, they are multifactorial, meaning many things come and interplay to produce mental illness. And we don't fully understand how that interplay happens. We know some things that can contribute. And those would be, first of all, hormonal. So you all saw that chart in the beginning of the cliff of your progesterone and estrogen just falling off. And that can produce, in some women are more sensitive to that drop off, and that can tip people into postpartum depression or anxiety. Biological, the organ of the brain itself is predisposed in various ways to developing postpartum depression and anxiety. And societal, you know, when we used to live in multi-generational homes or communities, and the children were sort of thought of as everyone's child, that there was a lot more support for women postpartum. Women still got postpartum depression and anxiety back then. Now they got it in lower rates. So we know that society, as it's currently structured, does create greater rates of postpartum depression and anxiety. And we know that, for example, having less support in your immediate circle makes it women more at risk for postpartum depression and anxiety, but that's not the only cause. It has always been a part of giving birth that some women will experience this. So here are some quotes, not direct quotes from specific patients, just kind of mashups to give you a sense of what it can sound like to have postpartum depression or postpartum anxiety. I had gone through so much to have my son, so I felt stupid and selfish admitting how miserable I was once he was born. I felt drained and exhausted and was extremely nauseous, so I hardly ate. It felt like a fog that descended on me and I thought it would never leave. It felt maddening, frustrating, and yet blah. I felt like I was inadequate as a mother, and I was sometimes too numb to feel sad. I resented my child. I thought we had made a terrible decision. I wanted to go back. I remember thinking while in the shower that if I could convince my husband to give the baby up for adoption, that I would. I felt guilty for not feeling bonded right away, for only having rare glimpses of that supposed all-encompassing gushing love. I felt guilty for doing things for myself or even for wanting to. I even felt guilty for feeling guilty. Straight up rage. Rage about how intrusive my workplace was while I was on leave. Rage about the expectations others had of me. Rage about how I felt I was failing at everything. Rage at how I missed out on so much time with my oldest. The emotional pain feels physical, like the empty feeling of having the wind knocked out of me, but in my gut instead of my lungs. So a few things I want to point out from these quotes. First of all, some of them can feel pretty shocking to read if this is your first time sort of hearing what people feel when they have postpartum depression and anxiety. And I think sometimes, especially because that term postpartum is thrown around so much, that how serious the mental illness can be lost. And it is a very serious mental illness, or at least it can be, just like normal adult depression, normal adult generalized anxiety disorder, there's different severities. And also, these quotes sort of state the quiet part out loud, where in postpartum depression and anxiety, people often do feel, for example, resentment to their child, which can be a feeling or a statement that is very rejected in society as never okay to name, but it is actually quite common in postpartum anxiety and depression. And again, to put a clearer label on it, the illness of postpartum depression, the illness of postpartum anxiety is creating that resentment. It's not the person, which is a difficult thing to kind of tease apart because our personhood is housed in the organ of the brain where this illness resides, which is one of many reasons why mental illness is so difficult and convoluted. But that separation from you, the mom, hating your child, and the postpartum anxiety or depression creating hate towards your child is a really important distinction. Another thing to point out here, feeling numb is something I hear a lot. Rage is very common. And postpartum depression and anxiety can present any time in the postpartum period. And so, by the books, that would be till 12 months. I really say to 18 months. And I often hear from people who maybe present a little bit later, this rage component of extreme irritability, sometimes like explosive anger or like constant simmering rage. The exhaustion leading to choices, or not choices, but symptoms of things that will make your mental health, of course, worse, like not eating, not sleeping. And this sentence here, it just didn't feel right. That often really, really nags at the women that present to me of, I don't feel right as a mom. I don't feel connected to them. I don't feel like they're mine, maybe. I feel strange. It feels like I'm acting. All those feelings, guilt, and a lot of physical symptoms as well. So this is just another slide making the contrast between what we talked about earlier with baby blues and postpartum depression or anxiety. So like we said earlier, it usually will start obviously later than the teary day 3. But the real important part is that if you can cross that 1 month and see that it's just getting worse, that's really concerning for postpartum depression. It interferes with the ability to do your daily life. So you can just feel the overwhelm mounting and mounting and mounting. You don't really engage with it. Intense symptoms of sadness, anxiety, and hopelessness. It may include loss of interest in activities, withdrawing from friends and family. That's a big one. You don't want people to come over, either because it makes you anxious or because it feels very overwhelming, even though you desperately need that help. And then again, like I've said, thoughts of hurting yourself or the baby. We've talked about 12 months, 18 months after birth, any point. And I often see after weaning from breastfeeding as another common point of presentation to see a doctor, and usually requires treatment, and we'll get into that. So postpartum depression and anxiety, what are the risk factors? So you have a previous history of depression or anxiety prior to becoming pregnant. You experience prenatal depression or anxiety while you're pregnant. You have a high-risk pregnancy. Your pregnancy is more stressful. Having a birth that feels traumatic to you, not whether it's labeled by anyone else as traumatic or a difficult birth, or things didn't go according to someone else's plan, that it feels traumatic to you as the mother, or that incurs some complications medically. If the pregnancy was initially undesired, which does not speak anything to your desire of your child that you have, but if initially the pregnancy was not part of a plan, that can increase your risk of postpartum depression and anxiety. The idea of parenting feels very stressful. So before you even have the child, your overall concept of what it's going to be like creates a lot of anticipatory anxiety and dread. That will increase your risk. Having a baby with a low birth weight, if you're pregnant as a teenage woman, that increases your risk. And women with a history of sexual abuse are at increased risk of postpartum depression and anxiety. And then in case I can't remember if I put this in a later slide, people often ask if you've had postpartum depression or anxiety, are you more likely to have it with subsequent pregnancies? And you are, but it is by no means guaranteed. I would say just clinically, I see women more often tell me that one of their pregnancies, they had postpartum depression, postpartum anxiety, rather than every time I'm pregnant, I end up developing depression or anxiety. So it's not an every pregnancy if it happens one time type of thing. But you don't know, sometimes it does happen again. So what are the treatments? So de facto, these are the choices that I've kind of come up with. De facto, you could do nothing. And I think sometimes we sort of treat ignoring it as a treatment sometimes. That is not an option that I would encourage for postpartum depression and anxiety. So we're going to cross off that option. Changing your stressors within your work or home. Some people might label this self-care. Therapy, medication and therapy, or the holy grail, the right answer, so to speak, change stressors, engage in therapy, and consider, so have a consultation about medications. And a consultation is all I ever offer for the first time I speak to women that are concerned about postpartum anxiety and depression. We never are headed towards meds, definitely. We're trying to find the right next treatment for you. And it could just be therapy, and it often is. How effective is the treatment? So if you did nothing but started to exercise regularly, there's actually very good evidence behind daily movement as good treatment for mild postpartum depression and anxiety. Another sort of aspect of self-care, quote unquote, changing the stressors would be enrolling the people around you into your treatment by saying, I need more support. I need more involvement. This is what I am struggling with, and having them change their behaviors and increasing their support. And then starting to practice more time with yourself, engaging in the things that brought you joy before you were a mom. In mild cases, 30% of those patients resolve, meaning their postpartum depression or anxiety resolves 30% of the time if that's all they do. First line treatment is always therapy, and access to therapy can be difficult for a multitude of reasons, including financial, unfortunately. And so patients that get enrolled in good therapy, about 70% of those patients, which would be the mild to maybe lower moderate cases, will have their postpartum mental illness resolved with therapy alone. And then medication. So 2 times more patients have their postpartum mental illness resolved with medication than with self-care alone. And as you can imagine, these studies are quite difficult to execute. So that's why it's not continuing with that percentage pattern. And then with changing your stressors, engaging in therapy, and using medications to help treat your postpartum mental illness, specifically depression, greater than 90% of patients fully have postpartum depression resolved. So that's a really amazing statistics, especially in psychiatry, that level of resolution that we can offer. So just another reason why engaging in care is so fruitful, because it actually works. And now I will allow Sarah to take over.
Hi, can you hear me?
Yep.
All right, great. Thanks for having me. I'm just going to discuss how breastfeeding ties into this because it's so big in the postpartum period. I'm currently working in Barton Family Medicine and a lactation educator. I'm actually teaching my first breastfeeding class on Monday. If anybody's interested, they can sign up. And I have a passion for this, but I also suffered and am still going through therapy for depression and anxiety after having my 2 boys. And so that was it's a big thing for me. It's really important. And it's great that we're talking about it, especially treatment options and what to do in that situation. So breastfeeding is big in the postpartum period. Most of the time women feel like they are just sitting on the couch breastfeeding, and that's what they're doing for, the first couple of weeks. And things do get easier, but it can feel like you are a cow and that's your only job is to breastfeed. And it can be even more difficult when you have breastfeeding issues and you don't have the support that you need to be successful with your breastfeeding. And so I'm all for breastfeeding, but if you can't breastfeed, then that's fine too. And I'll talk about that a little bit at the end of the slide. But one of the big things is that there's a lot of guilt and shame involved in not being able to successfully breastfeed. So I don't want to make anybody feel bad about that. I'm just talking about the benefits, and then we'll go into the other stuff. So a couple things on my slide. Many studies show that reduced risk of postpartum depression and among breastfed babies and moms, they are a little less. So the hormones that you release when you're breastfeeding are the love hormones, and they help you sleep. And believe it or not, if you're breastfeeding, you're going to sleep better. I know you feel like I'm waking up every 2 to 3 hours. What do you mean? But what happens is after you breastfeed your baby and you put your infant in a safe sleeping position and you go back to sleep, you fall asleep quicker. And it's because of the hormones that you're producing from breastfeeding. You usually fall asleep very quickly. So they're saying that with improved sleep because of breastfeeding, there are lower rates of anxiety and depression in the postpartum period. It's also protective against depression up to 2 years. So now the World Health Organization is saying that they're recommending 2 years, and so is the CDC and the Academy of Pediatrics. They're recommending 2 years of breastfeeding. Really, any breastfeeding is great if you can do it. And then they say that there was a lot of studies where moms were breastfeeding for 8 weeks or longer, and there was a decrease in depression and anxiety because they were breastfeeding. So there was some sort of correlation there. And I really think it has to do with the mother-infant attachment. And so your mother-infant attachment increases the likelihood of initiating and continuing breastfeeding, and it also increases your empowerment. So if your breastfeeding relationship is going well, and you feel supported, then you're hopefully will not have depression or anxiety, or it'll get better over time. And then I wrote here that there's, of course, this caveat where if you're having a hard time breastfeeding, it can cause increased anxiety and depression. And I hear that a lot. I wasn't able to feed my baby, or they say I struggled so much and I felt so bad that I had to stop. And so it's hard because you'll feel that way, especially if you don't have the support, the knowledge, or the resources to be successful. And that's really what we want you guys to have, so that you go into breastfeeding and the postpartum period feeling empowered that you can do it, and that there are resources here for you if you need them.
Next slide.
Next slide, please. So it's easy to create goals. We always create goals about the birth, and we kind of make up an idea of how things are going to be in the postpartum period, but we can't really control those things. And that's a big thing with depression and anxiety too, is if your birth experience is traumatic or you feel like it is, then you can have increased anxiety and depression too, because it's almost like you feel like you can't change it. You have no control over how your birth is going to go. And the same thing with breastfeeding. If you think you're going to breastfeed and you have that goal of, I'm going to breastfeed for a year, and it doesn't happen, and you're like, why is my baby not latching? Then it can increase your depression and anxiety too. So seek help. So to discuss the goals with not only your support people like your spouse, but also your mother-in-law and the people you work with. Because when you go back and you're pumping, you want them to know, this is what I'm doing. I'm feeding my baby and I'm going to be pumping, and you're going to see me doing this because my baby needs my milk. And then also just understand when to ask for help. So that's really important. If breastfeeding is feeling hard and you're like, wow, I really thought it was going to be easier. It looked like it was going to be easier. Reach out, ask the birthing center. I think I have the resources at the bottom. I can't see a couple of them, but you can always call me. I'd be happy to help you. And then you have the birth center as a resource. There's Roma there. She's a lactation consultant. And we also have our lovely women's health office, and the nurses there are great too for helping with things like this. And then just seek help in general and support from your loved ones. Let them know, this is hard. And because breastfeeding feels solely on the mom or the parent who is chest feeding, it can be very overwhelming because your baby knows nothing else other than you for 9 months and will really literally be a part of you for a year and not understand that they're a separate person until they're a year. And so it's very overwhelming, and it can be very difficult. And then just remember that your expectations and perceived failures, they can occur, and it's normal to have those. But when I said perceived, because when you don't feel supported, when you maybe have some conditions that would prevent you from producing enough milk for your baby, or you have to go back to work and it's not going to work out for you, that's fine. You have to feed your baby, and we just want to be here to help you if you need help in the postpartum period.
Thank you.
Yeah, thank you.
Okay, so just a few takeaways and then we'll do some questions. So takeaways for the normal postpartum period. So you need to balance your needs with your baby's needs, which sounds trite, but it's truly the crux of it all in some ways. And this is a skill that takes a lot of practice to get better at. Progress, not perfection. Something can be good for the baby, but detrimental to mom's mental health. An example would be what Sarah just spoke about. If breastfeeding is extremely difficult or causing a lot of anguish without support, it can be the right choice, if there's no other options, to go to formula or whatever you want. Important to recognize how impactful it is that you start practicing leaning into your needs early. Ambivalence is normal. I'll remind you of that slide, same baby, a slide full of the wonderful quotes that you'll hear and feel a slide full of the more pained quotes that you will hear, or mostly you'll feel. They're increasingly being said out loud, which is good. That's what we call ambivalence, that both of those things can be true. And that is part of a normal postpartum experience. Good moms feel ambivalent about the experience of being a mom. And set your expectations low and slow. It will be way harder at some moments than you ever expected. It will take you a lot longer to meet your new normal self than you probably expect. Give yourself grace and patience, and remind yourself that when you are not giving yourself grace and patience, what the expectations really should be, which is a safe baby, a basically cared for baby, diapers, feeding, warmth, and everything else on some level is really gravy. Takeaways: postpartum depression and anxiety. So we said I recommended a check-in with yourself honestly at baby's first month photos, and it should feel like you are on the other side of a hard adjustment. Things are a bit better. That should be the feeling. If instead you feel like you are drowning under a heavy weight, so anxious you can't eat or sleep, full of rage, or having intrusive thoughts specifically about hurting yourself or your baby, reach out that very day to your OB or primary care. The help helps. Like I reviewed, therapy and medications resolve the vast majority of cases of postpartum depression and anxiety. I specifically chose not to get into the weeds with medications because I think that that's a really personal discussion between doctor and patient. But it is a discussion and all questions are welcome. So please don't let a hesitancy of, I really don't think I'm going to want to start meds, to prevent you from coming to talk to either your OB, your primary care doctor, or myself or another adult psychiatrist, because I'm at least speaking for myself and the vast majority of clinicians that I've met, we want you to be well in the way that you think you will become well. You always have autonomy over your choices. And then remembering that postpartum anxiety and depression can occur at any period within the first 18 months after a child's birth, and to watch out for mood changes with weaning. And then the last thing I'll just share is the Postpartum Support International Helpline. You can call that number or text the other number. I always like to remind people, they don't guarantee that they will answer right away. So if you are in an emergency, again, especially those thoughts of hurting self or baby, that's a 911 moment, head to your local emergency room. But if you would like support and don't know what the next move is, they will get back to you within 24 hours. And again, if that small, quiet voice tells you something is wrong or seriously off, listen to it and do something. And we will help you from there once we know that you need help. And that is all. Thanks for having me. And Sarah.
Thank you both so much. That was wonderful. So informative. Just wanted to remind the attendees that you can ask questions through the Q&A box at the bottom or in the chat box. There is also an anonymous option if you wanted to ask a question anonymously. We know that some of these questions can be sensitive. And just in the meantime, to see if any questions come through, I did put a link in the chat box to Sarah's upcoming lactation class on Monday. You'll also find that on that landing page, there are a couple other resources like the, I think, what do we call it? I think it's the prep class, where you can learn all about how to best prepare for baby's arrival and get a tour of the Family Birthing Center, as well as a Mommy and Me support class that is offered, I believe, in partnership with our El Dorado County Community Hubs group. So just wanted to remind you all of that option. And also that this webinar has been recorded. So if you want to refer back to it, it'll be up on our YouTube channel shortly. So just checking to see, I don't see any questions. I feel like it was really, really thorough, which that's always a good thing. So I'll give it just a little bit longer. For those that are still on, also, we will be sending out, you'll get an automated survey just to kind of let us know how we did tonight. And then if you have other topics that you'd like us to cover in future webinars, we'd love to hear your ideas. We want to make sure these continue to be worthwhile for you. So, oh, let's see. I do think we had a question come through. So we have someone who is here to support her daughter who will be having her baby, and would just love to know if you have any suggestions for her, how to support as a grandmother figure.
Oh, that's a great question. I think there are myriad of ways that you could support your daughter. Probably a lot of them most moms and grandmas to be will think about. But I think stating out loud to your daughter that at times she will ask for your opinion and that you'll share it, but that you actually are not the expert on her particular baby and her particular motherhood. That no one can really be the expert on that except for the expertise she'll learn over time. And so that any answer you may give does not come with judgment if she should choose differently, and that you actually expect that a lot of times she will choose to do different, and that you'll be interested to kind of learn those different ways alongside her.
I thought that was great. I wish I had gotten that advice for my support group when I was pregnant. So that was great. Just checking to see if there are any other questions. I think we've covered it. If something comes up after this webinar, you are welcome to email me and I can relay those questions over to Dr. DeMay. You should have my email from the registration email that you received for this webinar tonight. But I just want to say thank you again, both of you, Dr. DeMay and Sarah, for being here. It was very thorough. Yes, getting some nice feedback that people enjoyed this webinar. So thank you so much. I hope you all have a wonderful evening and we'll see you at the next one.
Great. Bye, everyone.
Bye, thank you.